How can you tell if spleen changes are lymphoma on scans? Imagine trying to figure out if changes in the spleen are due to lymphoma just by looking at scans. It can be tricky because many conditions can affect the spleen. To tell if lymphoma is involved, doctors look for specific signs on different imaging tests like computed tomography, magnetic resonance imaging, and ultrasound. These tests help distinguish lymphoma from other benign or malignant conditions by analyzing the size, shape, and appearance of any lesions. On a CORT scan, lymphoma usually shows up as one or more focal lesions that are darker than the normal spleen tissue after contrast dye is injected. These lesions tend to be well-defined and can appear as a single mass or multiple spots. They often do not cause the entire spleen to enlarge, which is called splenomegaly, but instead show localized areas of abnormal tissue. Sometimes, these lesions may have calcifications, especially after treatment, but that is less common. The key feature is that these lesions are hypoenhancing, meaning they absorb less contrast and look darker compared to the surrounding tissue. MRI scans provide more detailed tissue information. Lymphoma lesions in the spleen usually appear as well-defined masses that are low or similar in signal intensity on both T1 and T2 images compared to normal spleen tissue. When gadolinium contrast is used, these lesions typically show little or no enhancement, which supports their hypoenhancing nature. An advanced MRI technique called diffusion-weighted imaging can also help. It often shows restricted diffusion in lymphoma lesions, meaning water molecules don't move freely within the tissue. This restriction helps differentiate lymphoma from other types of lesions that might have different diffusion patterns. Ultrasound, especially with contrast enhancement, can also be useful. It may reveal darker, hypoechoic areas in the spleen. Contrast-enhanced ultrasound can help distinguish lymphoma from benign conditions by showing characteristic patterns of blood flow and tissue response. It's important to remember that just having an enlarged spleen or some abnormal spots on scans does not confirm lymphoma. These imaging findings need to be combined with clinical symptoms, blood tests, and sometimes tissue biopsy for a definitive diagnosis. Blood tests may show abnormal lymphoid cells, which can raise suspicion. In some cases, doctors might recommend removing the spleen surgically to examine the tissue under a microscope. Differentiating lymphoma from other splenic lesions is also essential. For example, other cancers like angiosarcoma tend to show more intense and uneven enhancement with areas of bleeding, which is different from the usually hypoenhancing pattern seen in lymphoma. Benign cysts or hemorrhages may have different appearances, such as fluid-filled or heterogeneous areas. In summary, if scans show well-defined, darker spots that do not enhance much after contrast and have restricted water movement on MRI, lymphoma could be a possibility. But these imaging clues are just part of the puzzle. Always, a healthcare professional will interpret these findings alongside other tests and clinical information to confirm the diagnosis. If you or someone you know has concerns about the spleen, it's best to consult a doctor who can evaluate all the evidence and recommend the right next steps.